Hello everyone, I'm Mitch.
I'm Hannah.
I'm Kat.
I'm Connor, and we're doing meniscus tears in volleyball players.
Knee injuries, in this case specifically the meniscus, are very common in the sport of volleyball. It's first important to discuss what causes meniscus tears in volleyball players. The menisci are fibrocartilages firmly attached to the superior plateaus of the tibia by the coronary ligaments and joint capsules. Meniscus tears are almost completely due to compressive, tensile, and shear forces caused by the femur. The femur rotates on a fixed tibia, and depending on the motion of a particular movement, the tibia can then trap the horns of both menisci, causing a tear.
There are 4 types of meniscal tear classifications. First would be a longitudinal tear. This tear is a result from a twisting motion when the foot is fixed and the knee is flexed. This action produces compression and torsion on the posterior peripheral attachment, the inner substance of the meniscus. Second is the bucket handle tear, which occurs when an entire longitudinal segment is displaced medially toward the center of the tibia. This tear can lead to locking of the knee at approximately 10 degrees flexion, and usually only occurs in approximately 40% of complete meniscal tears. The third type of classification would be the horizontal cleavage tear. This tear is a result from degeneration and often affects the posterior medial portion of the menisci. The fourth and final classification is the parrot beak tear. This tear is actually 2 tears that commonly occur in the middle segment of the lateral menisci, leading to the characteristic shape of a parrot's beak. This tear is seen more frequently in individuals with a history of previous trauma or some cystic pathology that makes the meniscus more fixed at its periphery.
Hey, we have Connor here from the University of Saskatchewan. Connor played for the men's university volleyball team for 1 year before he was forced into an early retirement because of a career-ending injury. Hey, Connor.
Hi.
Tell us about your injury.
Okay, yeah, so I was at practice, and I was just passing the ball, backing up, and my knee kind of turned medially a little bit, and I felt this weird pop, and so I sat down, and what do you know, my knee is locked at 90 degrees, can't straighten it, and it did not feel good.
With meniscus tears, the individual may experience a popping, grinding, or clicking sensation that can lead to the knee buckling or giving in.
What actions were taken directly after your injury?
Okay, so yeah, I was kind of sitting on the ground there, couldn't move, so we just went over to the side, and trainers took a little look at it. Then we moved to the training room. They tried to fit me for a brace, but we couldn't really find any. So we made a makeshift sling just to support it a little bit. I got fitted for crutches, and then we went out to the hospital.
If the knee so happens to become locked, the most important thing to do is to control the pain. After that, you would want to brace the knee to prevent movement, size and fit for crutches, and lastly, but most importantly, go to the hospital. Meniscal tears are a medical emergency.
What was your rehabilitation period like, and what kind of program did you have to do?
So I had to stop playing volleyball for quite a while until I had surgery, and then after they repaired my meniscus, I was out for, I don't know, probably 6 weeks before I could even start physio. And then that took 3 months itself too. And now I'm finally ready to actually start doing sports again.
For examples of a rehab program, please refer to the handout you were given.
How was Connor with us from the University of Saskatchewan men's volleyball team on career-ending injuries? Back to you, Mitch.
Take-home message here is that recurrent locking is typical, active pain-free range of motion is key, and I'd also like to ask you to refer to a handout to find a detailed emergency action plan.
There are many steps that can reduce meniscus injuries in volleyball players. Protective equipment, physical conditioning, and footwear are the key components. Prevention programs should start 3 months prior to the start of the season and focus on balance, control, strength, and flexibility. For balance and control, activities on hard, soft, stable, and unstable surfaces, as well as in single, double, and tandem stance positions are best. Specific footwear to your sport is also key. For volleyball, court shoes that add more side-to-side stability are preferred. Some really good warm-up exercises would include jogging and high knee skipping. A conditioning program that can be done at the end of every practice should include stretches that focus on quads, hamstrings, gastrocnemius, IT band, and your adductors. Strengthening of those muscle groups, as well as your abs, will help with knee stability as well. Strong core absorbs and transfers force throughout the body. Weak core muscles won't be able to slow the body down during movements, leaving the knees to bear the brunt of forces. Relating back to volleyball, certain jump approaches and landing techniques should be taught to all athletes in order to minimize the valgus strain on knee and too deep of knee flexion. And as an athlete, it is always key to warm up properly, stay hydrated, and take lots of rest. For example of prevention methods, please relate back to the handout. Well, that's all for today. Thanks for watching our video on meniscus tears in volleyball players. I'm Hannah.
I'm Mitch.
I'm Kat.
And I'm Connor.
And remember, don't be dumb, use your bum.